So typically when we decide, the family and myself, to proceed with the surgery, the first thing that happens is the surgery gets scheduled. The scheduler comes in, discusses the optimal time for the surgery to be performed. It is an elective procedure. It is typically not emergent. Some curves are progressing more rapidly than other curves, where I would focus on more of an expedient correction rather than delaying too far down the line, like 6 months or sometimes the summer. Once it's scheduled, we typically see the family a week before the procedure. Maybe additional x-rays are obtained, consent's obtained. The day of surgery, I again revisit the family in the waiting area and also in the pre-op holding area where the child receives an IV and typically medication for them to pretty much be sedated. And at that point, they don't remember much of the procedure until then, and they don't remember much of anything until they wake up and the family is back with them. The procedures typically take between 3 to 4 hours, 3 to 5 hours. I visit the family once the surgery is performed, discuss the procedure, and likely provide them with the x-rays both preoperatively and postoperatively through their email or other digital type form. The hospital stay is approximately 3 to 4 days. That's for pain control, getting your diet back to normal, walking. On the day of discharge, you're walking on your own. You don't use any assisted device such as a cane or a walker. Typically, a dressing is provided on the back at that point that's waterproof, so the child can go home and shower. Again, walking, sitting, standing to their tolerance. We don't want them laying in bed. We don't want anything, at that point that's actually worse than providing motion to the spine. And then they follow up in 2 weeks. At that point, the dressing is removed and no other dressing is necessary. Pain medication is provided during the hospital stay, and short outpatient medication for a short period of time, typically a week postoperatively, is all that's necessary.